was a recently published study in New England Journal of Medicine comparing VMP to the addition of dara-VMP. And the reason this is an important study is historically there's this perception that elderly patients cannot get more than one drug because they're going to have more toxicity. But I think we have to be mindful again of what drugs we're talking about. If you combine drugs with overlapping toxicity, you're going to have more side effects. And so here, VMP, which is not as widely used in the US, but it's a very widely used regimen globally, basically is bortezomib, melphalan, and prednisone. And that was already shown in the VISTA study to be superior to melphalan and prednisone, which is an oral doublet regimen. So we know that VMP resulted in better overall survival than MP. So the question is, can we now further improve upon VMP? And in this randomized study, transplant-ineligible patients are randomized to either VMP or the addition of dara in standard dose and schedule. And so what this study showed is, very impressively, all of the efficacy endpoints were met. So we saw improvement in response rates, improvement in CR rates, improvement in MRD negativity, and an improvement in progression-free survival. So this is really encouraging data for a population, as we'd said, is historically an unmet medical need, which is the elderly patient population. So to see improvements in outcomes in this population is really exciting. For this ALCYONE study, when we compared dara-VMP to VMP, the safety was also very encouraging in terms of there was no significant differences in cytopenias, and the main difference, there was a slight increased rate in infection. But again, this is an elderly population with a lot of comorbidities. Infections are very common in myeloma, but I think it does bring to mind that we need to be very aggressive with elderly in terms of supportive care like growth factors, antibiotics, and potentially the use of intravenous immunoglobulin if somebody's very hypogammaglobulinemic.